So today I'm going to be treating the knee using the Tecarpuls from Enraf Nonius. Go into the knee arthritis and press OK. You'll see it's preloaded the intensity to level 9 and 7 minutes. 7 minutes might be quite a long time to do the anterior joint line, which is what we're going to be doing today. But we'll leave it at that and see how we go on. I like to do 1 minute per treatment head size. I'll bring the thermal camera in here. You see the knee itself is about 29 degrees. We're going to be doing the joint line, so I've actually put a paper roll underneath the knee to open up the joint line, open up the anterior joint margin. We'll start off by adding some contact medium to the earthing electrode, and we'll just put that in a convenient place to make the capacitive energy transfer work. I like to put the pad anywhere where there's a fleshy area. It really doesn't matter. I don't really like to put it under a bony area, so I won't put it underneath the heel. I'm going to bring in the contact medium now and put it across the anterior joint line, really where I'm going to treat. You can do this treatment with the patient sat over the edge of the bed, or if you've got a roller that you can use that roller. I'm using a paper towel just because it's convenient, and of course I can just tear the paper off and throw it away. So here we are. Just put the machine on. I've spread the contact medium around the area that I want to do, and I'm going to come across the anterior joint margin. You can't really avoid doing the patella tendon when you're doing this. That's not really a problem. You're going to put heat into the joint anyway, and although we don't really want to put the heat into the patella tendon, it doesn't matter that we're coming across it, and we will heat it anyway. It's just one of those consequences of doing the treatment. We want to get the treatment into the joint as much as we can. Most commonly done from the front of the knee is this, rather than from the back of the knee. If you look at the literature on Tecar, you'll see by far and away the most researched area is the knee, and the most researched area is arthritis of the knee more specifically. So the bulk of the papers on arthritis are in the knee, and the results tend to be good, short to medium term. Obviously long term, the Tecar is not going to cure the arthritis. This is a treatment for people with symptoms of pain, and pain particularly, actually, if you look in the literature, you'll see many of the studies have not been able to correlate an improvement in range of motion. You do tend to find an improvement in pain. That tends to be significant in the bulk of the studies. And you tend to find an improvement in function. These are scores that the patients have been asked. There are various different scores. As this is a long treatment, I'm going to skip forward to the end of the treatment. 7 minutes would be a long video to sit through, and we'll see what the thermal camera says. So at the end of the treatment now, we'll bring the thermal camera back in, and as you can see here, exactly where I've been using the Tecar along the joint margin is heated up about 34 degrees. That's a significant improvement in the temperature.